So now what I understand, and I hope we are able to convey this to people, that every investigation has a reason behind it. It is not
Absolutely.
that we just simply write a list of investigation and
Absolutely.
there is said why so many investigations for
Right.
fever. But then there is a logic behind it.
Absolutely. And see, you need to investigate more now because there are quite a few of these illnesses which have an overlapping symptomatic pattern. All of them will prevent with fevers. Okay, you will have rigors or chills in dengue, but the same you can have in urinary tract infection also. You can have those in your chikungunya also, right? And body ache again is a constant. Most of the fevers they present with body ache. So, it becomes very difficult sometimes clinically also to differentiate between this. Okay, and that is the time you will need to add on to more tests in order to save time and reach an early diagnosis.
Right, sir. And on that body ache thing, I just realized
Yes.
many a time patient used to come to us and ask us that you did chikungunya in the beginning, it did not come positive. Now
Right.
after 1 month, again you are asking for chikungunya. Now that
True.
test is coming positive. It's
True.
a very common question. Obviously,
Common
any
question.
patient will ask. So if you
Yeah.
could just put some light on that.
Right. So see, what happens is that, as I explained earlier, okay, there is for an early diagnosis, the tests are different. Okay, like in the first 5 days, if you're looking at chikungunya and you're giving a prescription of chikungunya IgM, that test is not going to come positive. It takes at least 7 to 10 days for the IgM antibodies to appear. So during this phase, you should be doing a PCR. Okay, so typically this is a standard thing and standard query which we also face. That I had 4 or 5 days of fever. I had done this chikungunya test. Okay, it came negative, and after again a month, it is still the symptoms are still there, and it is coming positive. So then we have to explain it to the patient that in the first 4 or 5 days, the chikungunya IgM antibodies will not be positive, because ultimately it is the body's immune response which is getting developed to against chikungunya, and that is what we are picking up with the IgM antibodies. So instead, a PCR has to be done. The same thing is with dengue also. So in early stages of dengue, you have to do a dengue antigen test. Okay, if you do a dengue IgM or a dengue IgG, that is not going to be useful. So which test to be done at what point of time is also important in order to reach a diagnosis. And IgM antibodies are not to be done in the first week of illness.